Welcome to the deep dive. Today we're getting into something pretty fascinating where AI meets medicine.
Specifically, hand surgery.
Right, which is incredibly intricate. It needs such deep anatomical understanding, and every patient is different.
Absolutely.
So our focus is this new AI tool, HandRAG. It's designed to help clinicians make decisions in hand surgery, and it was just detailed in a peer-reviewed paper.
Yeah, it's quite innovative.
Our mission today, to really explore how this specialized AI works, what it can do, and, well, what it means for using solid evidence in such a complex medical area.
Sounds good.
Okay, so to really get why HandRAG is a big deal, we should probably first touch on the challenge itself.
Mm-hmm.
Making decisions in hand surgery is it's really complex.
Mm-hmm.
And while those big general AI models, the LLMs, show some promise in healthcare.
They do have limitations.
Exactly. Especially in specialized fields. They often can't access the very latest verified research.
Which is critical in medicine, obviously. You need current, reliable info.
So HandRAG steps in here.
That's the idea. It's actually the first system like this for hand surgery using what's called retrieval-augmented generation, or RAG.
RAG.
Yeah. And what's really interesting is how RAG tackles those typical LLM problems. It essentially gives the AI a very specific, very large library to check before it answers.
So it's not just pulling from its general knowledge, it's referencing a dedicated hand surgery library.
Precisely. A highly curated one.
And how is this library built? What's in it?
Well, they integrated a huge amount of information, over 4,500 open access, peer-reviewed hand surgery publications.
Wow, that's extensive. Spanning what time frame?
From the year 2000 up to 2024, so pretty current.
And they didn't just feed the documents in raw, right? You
Yeah.
mentioned processing.
Right. They used advanced methods, like something called the Raptor methodology.
Raptor.
Yeah, it helps the AI understand the structure, the context within the papers, not just keywords. So it can retrieve really relevant paragraphs or sections, not just whole documents that might only be partially relevant. It enhances the accuracy of what it pulls out.
Okay, got it. So walk us through the process. A clinician asks a question, then what?
Okay, so a question comes in. Let's say about a tricky procedure. HandRAG first analyzes the question to understand the core need.
Mm-hmm.
Then it searches its knowledge base, those 4,500 plus papers, for the bits that are most semantically similar, closest in meaning.
Yeah, man.
Then it synthesizes all that retrieved information into a comprehensive, evidence-based answer. And here's the really crucial part.
The citations.
Exactly. It provides citations linking directly back to the source papers, so you, the user, can actually check the evidence yourself. Full transparency.
That's huge for trust and verification. So how well does it actually perform?
Actually, quite consistently well. In tests using 15 standard clinical questions, it hit an average G-EVAL correctness score of 0.79.
Okay, what does G-EVAL measure?
Think of G-EVAL as basically factual correctness, how right the answer is.
Got it. And there was another score.
Yes, and some similarity score of 0.75 on average. SEM looks at how much the AI's answer reads like something a human expert would write. So it indicates deeper understanding, not just matching words.
Interesting. So good correctness, and it sounds like an expert. Any specific examples where it really shone?
Definitely. It did really well on questions about zone 2 flexor tendon repairs. That's notoriously difficult territory in hand surgery.
Often called no man's land.
Right, that's the one. And also on Dupuytren's contracture treatment options, another area needing careful, personalized decisions.
And the scores there.
For both, it got high SEM scores, 0.86 with high confidence. It provided detailed guidance on repair techniques for the zone 2 tendons, including rehab protocols.
And for Dupuytren's.
A really thorough analysis of the factors involved, like the patient's age, how severe the condition is, their preferences. It's like getting a very fast, evidence-based second opinion.
That's impressive. But it wasn't perfect across the board.
No, and that's also informative. Performance was a bit lower for very niche, highly specialized scenarios.
Like what?
Well, one example was pyogenic flexor tenosynovitis. That's a specific type of tendon sheath infection, but in immunocompromised patients. There's just less literature specifically on that combination.
So the knowledge base wasn't as deep there.
Exactly. The SUM score was lower, 0.54, with low confidence. Which, connects to the bigger picture. It shows where the knowledge base can still be expanded as more research comes out in those ultra-specific areas.
Right. So bringing this back to the user, what's the main takeaway here? You mentioned verification.
I think a key advantage of these RAG systems, like HandRAG, is their potential to seriously cut down on AI hallucinations.
You mean the AI making stuff up that sounds plausible but is wrong?
Precisely, because HandRAG grounds every answer in specific, citable literature from its knowledge base. The aim is highly accurate, verifiable guidance.
Which makes it potentially really valuable.
For sure, both for supporting decisions right there in the clinic at the point of care, and also as a tool for surgical training and education.
So HandRAG is really significant then. The first RAG-enhanced AI, specifically for hand surgery, filling a key information gap.
It definitely underscores the potential of this kind of targeted, knowledge-grounded AI.
Absolutely. Now, we should mention it is still a research prototype.
Right. It needs more clinical validation, real-world testing, and of course the knowledge base needs to be kept up to date constantly.
But the implications are pretty profound.
They really are. And maybe here's something for you, the listener, to think about.
Hmm.
How could this model of grounded AI that prioritizes verifiable, evidence-based information change things?
Not just in specialized medicine.
Right, but in any field where getting precise, trustworthy knowledge is absolutely critical,
Hmm.
how might this shift how you approach and evaluate expert information in the future?